Welcome everyone. Thank you for joining us today. We hope you had a bit of a break over the holidays. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 555,207 confirmed cases of COVID-19 in Canada and 171,416 cases in Ontario. Chatham-Kent has 650 cases and Sarnia-Lambton has reported 673 cases. Michigan now has 480,508 cases, with 25,365 cases being in Detroit. Today we are reporting 157 new cases of COVID-19 in Windsor and Essex County. 16 cases are related to outbreaks and 141 cases are still being investigated. We have had 7,211 cases since March. 5,285 cases are now resolved and 1,797 cases are active and being followed by our health unit. 79 confirmed cases are currently in the hospital and 17 people are in ICU. There are also 131 suspected cases of COVID-19 currently hospitalized. Today, we are reporting 2 additional deaths due to COVID. A man in his 70s from a long-term care home has passed away, and a woman in her 70s from the community has also passed away. Our community has lost 129 people to COVID. 79 deaths have occurred among residents in long-term care and retirement homes. There are currently 44 active outbreaks in Windsor and Essex County. 18 are in long-term care and retirement homes, 17 in workplaces, 2 in schools, 4 are community outbreaks, and 3 are in the hospitals. As our case counts continue to rise, we are asking you to please visit our website at wechu.org for further information and instructions. We have made our website easier to navigate for people who have tested positive for COVID, those that have tested negative for COVID, and for those who are deemed close contacts of a case. In addition, we have started using a virtual assistant and want to assure people that this is a legitimate tool our health unit is implementing to collect further information from those of you who have tested positive. If you have provided your cell phone number, the virtual assistant will send a text message to you to collect some key information. This process will help us to quickly identify new contacts of cases and get in touch with them in a timely manner to reduce the further potential of spread. If you provide your mobile phone number, you will receive a text message that will take you to the virtual assistant tool. If you do not want to participate in the virtual assistant, you can text STOP at any time and you will not receive any further messages. These text messages are not spam, but are one more tool to help us stop the spread of COVID-19 in our community in a quick and effective manner. If you receive these text messages, you can help by providing the most accurate information possible in a quick turnaround time. This will allow us to get in touch with your contacts as soon as possible. In addition, please continue to follow the public health measures. Stay home if you're sick, limit your close contacts, maintain a 2-meter distance from others, wash your hands, wear a non-medical mask or face covering, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. If you haven't already done so, please download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again today. Last Friday we didn't present our epi summary, and knowing that our office was closed to public for a few days, we thought we'll just bring you some relevant data for you to take a look at what's happening around the world as well as locally. So jumping into my presentations and slides, a quick look around the globe. The pandemic continues to spread in many other countries, and some countries, after implementing more strict lockdown measures, control measures, they've started to see a decline in the cases, which is pretty evident in many countries, and notable, I guess, among all these countries is France. They have seen really high case rates back in October. Since then, they put strong control measures for the month of November and December, and now their case counts have gone down significantly. What we are still noticing is the cases in the United States continue to be one of the leading country with respect to case per million population. We've seen an uptick in UK, probably as a result of new strain, which is more virulent and is spreading quickly in UK. We have seen some of these cases in Canada as well. Looking at the overall picture of cumulative cases, US has the highest cumulative case per million population in the world, and Canada is still, compared to many of the other countries, are in a much better shape. When it comes to the deaths per million population, and this is reflecting the daily cases, daily deaths reported, Canada as a country, we stayed relatively stable with respect to the number of cases that we are reporting based on per million population. Overall, we have done well with this, with some countries, and with some other countries, maybe we could have done better. Now focusing just in Ontario, this is what the picture looks like in Ontario, and as we can see, the peak, we continue to see increased cases in the community. It almost seems like, based on the 7-day moving average, that we have touched our peak, but we also have to recognize that many of the areas are now in extreme control measures or restricted measures, red or lockdown measures in many places before the province implemented the full lockdown in the province of Ontario starting December 26. So looking locally, obviously our case rates continue to increase, have increased significantly throughout the month of November and December. We're starting to see a peak at this time, but it's too early to say if we have reached our peak at this time or not. With the increased control measures that have been put in place in Windsor-Essex, we hope that it would help us bring our case counts down significantly, but we are still in the early phase to see and detect any changes in the short run. So this is just a closer picture of the same graph, just focusing from September to the present, give you a better idea of the day-to-day fluctuation and the 7-day moving average as presented in this graph. When it comes to cumulative case counts and deaths, and as I reported earlier, the best way to understand this graph is to look at the steepness of the curve. And if you can see this particular graph, we are almost, it seemed like we're hitting a wall at this time. That's how high it's getting quickly in a short period of time. So this is definitely very concerning for our community, and it's reflected back in our cases. Our last case rates that we have gone through from 6,000 to 7,000, I believe it was just in 6 days. When it comes to Windsor-Essex case rate by reported week, this is another week-to-week calculation, and what we can tell you based on the most recent weekly case rate, our case rate was 280.8 cases per 100,000 population, and we can imagine that a jurisdiction goes into red restrict zone when the case rate exceeds 40. So we are right now at 280 cases per 100,000 population for our region. This is how we compare ourselves with the province of Ontario as well as the southwestern Ontario, and most of the southwestern Ontario, again, it's driven by our population size and our case rates. When it comes to person positivity of all the tests that are being conducted in the province, what we can see in our community that for the week ending on December 19th, our person positivity was 9.6%. And in total, we have completed 184,691 tests as of December 19th. When we are comparing ourselves with the percent positivity and the rolling average, our percent positivity is right now is the highest in the province of Ontario, even exceeding Toronto and Peel, which had a historically high percent positivity in the second wave of this pandemic. So these are the percentage of test results that are available within 1 and 2 days based on the 7-day average. And as you can see, we were doing better a few weeks ago, and then we started to go down with respect to number of test results that are available to us within the 24 days. Similar picture in the 48 hours timeline in our region. Looking at our overall rates right from the beginning of the pandemic to date, the regional and provincial rates, our case rate is at number 3 in the province, with many other health units are way behind the top 4 regions of the province in the province of Ontario. So this graph breaks it down, all the cases by the exposure history as reported, and as you can see, many of these cases are still under investigation. And when we are saying under investigation, it doesn't mean that we haven't made any contact. It just means that the case investigator hadn't closed the case yet by having all the information available, but most of these individuals are already identified about their positive case rates, and their contacts are identified and have been reached as best as possible with our team to provide them with the instructions. But the detailed case investigation, it continues is still ongoing. What we can see from the active outbreaks, as Teresa reported, we have 44 active outbreaks, and that outbreak number is increasing significantly. We have 18 long-term care home and retirement home under outbreak at this time, which is a significant concern, but most of these outbreaks are still well contained and well managed. There are 5 or 6 homes that are still evolving or struggling with containing the outbreak, but majority of them are still fairly contained outbreak. Hospitalization and ICU rates in the region, it again is showing not a good picture. Our overall hospitalization and ICU have increased significantly in the last month or so, and it continues to be on the increasing trajectory at this time. So when it comes to current outcomes, as we know that many of the cases are still not closed and are currently being investigated. So majority of the cases that you're seeing under unknown category, they will all probably lump into the self-isolating category. And the number of resolved cases continues to be 74%. And unfortunately, we have lost 1.8% of our residents as a result of COVID. The age and sex breakdown of COVID-related deaths, as we can see, majority of the deaths happen in individuals 80 years and older, followed by 70 to 79 years, and the youngest people who lost their lives to COVID were 2 individuals between the ages of 20 to 29. Looking at our case doubling rates as represented by the blue line, and as we have done much better in September, October, and then things start to turn against us, and we started to see a decrease in the doubling time. And right now we are still well below the Ontario as well as Canadian doubling time, which is again highlights the importance and significance of our COVID control measures in the region. So those are all the slides that I wanted to share today, and we'll be happy to take any additional questions. Thank you.
So we'll now take questions from the media. We're going to start today with Blackburn. Oh, hang on one sec. Sorry about that. Sorry. Go ahead.
I'm going to hold off and ask in the next round, I think.
Okay. So then we're going to go to the Windsor Star.
Yeah, good morning, Dr. Ahmed. Good morning, Teresa. Can you share more information about this new text system that you've got going on? What information will people be asked to share virtually to make the process more smooth?
So the virtual assistant is a mechanism through the province, and it's part of the overall system. We call it CCM, Case and Contact Management System. And so it is a tool that we're able to, we've been piloting, and that's why it was necessary to bring it here, because some people have, mistaken it as spam, which is very good on their part because they're being very cautious. But it is just, if we're able to have the cell phone number of the person, it's a text message to the case, so someone who has actually tested positive. And the information we're trying to gather is related to their contacts, their close contacts. So they'll be asked to identify the close contacts and submit that information, and then it allows us to get that very quickly rather than waiting for the phone call. So this is something that we are using. We have people that are calling cases immediately, well, not immediately, but as soon as possible, to let them know that they are positive and to remain in isolation. And at the same time, they're making them aware of the virtual assistant app and seeing if they have a cell phone that we can, use for these text messages. And as I said before, if people don't want to participate, that's fine. We will, reach them eventually. If they choose to, stop participating, they just have to text stop. So that's kind of it in a nutshell.
And you said that our region had been piloting it. Are we still piloting it, or is it rolled out across Ontario?
Well, different health units would determine if they needed to use it or not. It is accessible for other health units as well. We were just piloting it internally in our, in our follow-up because the cases are so high and we're so delayed in reaching people. We thought this would be a good mechanism to test out. So about a week ago, maybe a little longer, we started, testing it out. So it's really not a pilot anymore. We're using it for those that want to participate.
And can you speak to how this is a helpful tool that will assist the health unit in actually reaching out to such a large number of people?
It will allow us to reach the contacts in a more timely manner. So if you're a case, you're isolating and you have stopped the spread of any further transmission. But if you're a contact and you're not aware that you've been a contact to a case, then you may still be going about your business. And so we want to reach the contacts as quickly as possible and make sure they are isolating as well and, monitoring themselves for any symptoms. So it really is to stop the transmission by reaching the contacts of anyone who has tested positive and get them isolating as quickly as possible.
Okay, that's everything for now. Thank you.
Any questions from AM 800?
Dr. Ahmed, I just want to get your thoughts on the church gatherings that have been happening in our area. I know two were in Wheatley, so that's Chatham-Kent, but obviously Leamington's right next door, and who knows, residents might live in Leamington that go to that church, but also the one in Windsor on Spring Garden that held a mass. I just want to get your thoughts on these gatherings.
So, Rob, I think the message that we already put out on, I believe, on Christmas Eve highlighted the importance of people following these measures and recognizing that religious gatherings are a critical part of many people's life. And it's important to have that connection, but we also have to recognize that what we are dealing with is a global pandemic, which is spreading very quickly, including in our region. What we have seen, it's how quickly we have gone in that position. And with the new strains, we don't know what kind of strain are circulating in our region. It may take some time before we get to know that. And we're having all those information at this time, I do feel that it's really important for people to understand that any opportunity which brings you close to people who you do not live with, it's a risk. And that risk we have seen how it impacts families. You may be fine, but you may infect someone else who could die from it. And that's the critical message, especially for many of the seniors and elderly people. They like to go to church, they like to socialize, and I think that's where it makes it even more risky situation. So knowing that, I think our religious leaders should definitely take that into consideration in their decision. It's all about protecting everyone, and I believe, as far as I can say, is doesn't matter which religion who practices, saving a life is worth more than anything else. So I think people should follow that, and people should respect that, and recognize that this is not an easy situation for anyone, and we all have to do our part to keep everyone safe.
Thank you. Another topic here, when it comes to the provincial lockdown, what retailers can remain open? The reason I ask this, I'm not sure if my colleagues have received calls or emails, but we're hearing that there's some retailers, and I don't want to name drop, but I think I have to on this one, like stores like Best Buy, are they allowed to open during the provincial lockdown?
Well, we'll have to check with our team. I don't think so. I think at this time with the provincial lockdown, there are specific stores that are allowed to open, and mainly those are grocery stores are identified as grocery stores are providing the key essential products, and they are the only one who are supposed to stay open. Others can stay open for curbside pickup. For in-person, I don't think that anything that's not identified as a grocery store, not even identified as registered as grocery stores, they can stay open. But that's something that I think my team can better look at it and can respond directly.
Okay, thank you. Like I said, I didn't want to name drop, but we've been getting calls and emails about that certain store, so I was just wondering if electronics were part of that, but that's it for now. Thank you.
Any questions from CTV?
Yes, hi, good morning. I was just wondering how you're kind of feeling about the large spikes we've seen. Are you concerned? And are you considering, or would you consider extending the school break locally longer than the province mandate of January 11th?
Well, obviously, the case rates that we are seeing right now is really concerning for all of us. And every day we look at these case rates and we're just shaking our head and looking at that moment when we start to see a decline in the case rates going back down to maybe to double digits and then all the way down to maybe less than 50. So that's the hope, but right now it looks very distant. We will be looking at our data more closely as we come close to next week, and then make some local recommendation. At this time, recognizing that at least the second or the first week of January is already switched to virtual, and what happens the week after, I think it really depends on the data and information that we have next week.
Thank you.
Any questions from CBC?
Hi, yes, good morning. Just to follow up to that, in addition to obviously the large spike in cases, we're also seeing a spike in the death rate, 24 deaths in 6 days. What goes through your minds as you see that death rate climbing?
Well, I think first of all, just to make sure that everyone understand that how these deaths are reported, sometimes there may be a delay in a day or two in terms of the reporting processes that the facility where these deaths are happening, how they are reporting it to public health, and then public health putting it in the information out. So I just want to make sure that everyone understand that, you know, that this may not happen specifically on that day when we are reporting. So that's one thing. Second thing is, I think when we are seeing these cases, we know, and we have seen that in the past as well, that every time you have a spike in cases, there are a proportion of people will die from it. And we know death is a lagging indicator. And what we have seen more recently with the spikes, there will be more deaths. And I don't know, as bad as it sounds, but that's the reality. Even right now, our case fatality rate is close to 1.8% to 2%. So just imagine when you have 1,000 cases in a week time, you can expect that there will be at least 18 to 20 people that would die in just 1 week. So that's just the reality. And again, it all depends on what information that we have. We may see more deaths based on because 1.8 to 2% can exceed. Previously, we have reported up to 2.6%, 2.8%, or close to 3%. So we don't know where we will end up with when we get all these hospitalization and ICU that are currently having these positive patients and the outcome of their admissions. So we don't know that yet, but we would anticipate that there will be more deaths, and that's why it is important for people to understand that, you know, it's maybe many of you will recover fine, but there will be a number of people who will die, and that's something that it doesn't sit well with none of us here at the health unit, and I'm sure that many of our community members, they also recognize that. But unfortunately, there are a few people who think that maybe it's fine for them to be out there, it's fine for them to do whatever they want to do. But at this time, I think we should all respect the lockdown measure that are currently put in place. It would be a waste of this lockdown and a waste of all the efforts that have been put forward by your healthcare workers, your public health staff, and many of the businesses that are affected by it. The longer it stays, the longer it will have a negative impact on everything, including the mental well-being, including the economic well-being, including social well-being. So if we want to really get in control, we need to follow those lockdown measures to save lives. That's the most critical thing. And then we have to talk about how do we get back and bring everyone back to with their mental health, with their social wellness, with their economic well-being. We all have to think about that. And I think we all understand that, but it's just a step-by-step process. The top priority, for me at least, will continue to be the health and well-being of our people.
I also want to follow up on what Rob mentioned. Obviously, we know about some of those religious gatherings that happened over the holidays. I'm wondering if you're aware of any other violations in our community that you can speak about. And to that end, were there any fines issued over the holidays?
I don't think that I'm aware of anything in particular that any violation that's reported to us, but recognizing that most of the businesses and most of the areas that we work in public health were already closed. There was many enforcement activity that's been done by other, I guess, municipal and police enforcements. From our perspective, nothing crazy. I think there was at least one charge over the weekend, but that's all I'm aware of.
Okay, thank you.
Any questions from Blackburn?
Yes, I'm just trying to get caught up because I was off last week. I guess, Dr. Ahmed, now that we have 79 people in the hospital confirmed, 131 suspected cases. That's now 210 people in total. How concerned are you about the capacity at hospitals? And is there any talk yet of reopening the field hospital?
Well, as I mentioned earlier on, obviously every day when we are looking at the numbers, we are concerned, and we recognize that just like we talked about the number of people who will die from COVID as a result of just being positive, there are a number of people who will end up in the hospital system. So the most recent data that based on our local data, what we can share is the hospitalization could be anywhere between 8 to 10%. So same idea that if you have 1,000 cases in a week time, you can expect that at least 80 to 100 people will require hospitalization at some point during that week. So I think the numbers are there, the data is there, and it really is concerning to see that our hospitals dealing with that many cases of COVID in the region. And as we have mentioned before, that there are some other pressures in the hospital system too. There are staffing pressures as well. There are number of supports that these hospitals are providing to the long-term care home and retirement home. And then on top of that, providing care to their own facilities. So there are a number of options that a number of pressures that the hospitals are facing right now. And I know the Windsor Regional Hospital is looking at all the options. If that pressure exceeds, and if there's any need to open up the St. Clair College as the backup site. But again, it will go back to the same idea that would still require more staff, and how are we bringing staff there? But again, I would just leave it at there, but all of those options are on the table, but no decision have been made yet.
You know, if they would consider bringing in staff from perhaps a region of the province that is not hit as hard?
So there are a number of conversation that is already happening, and I know at least for EMS that they are getting some additional support from other region. The staffing, again, it's a difficult issue like these staff, they cannot work virtually. They have to be in town and they have to provide that care. It's not easy to make that kind of resource available, but I guess that's something that the hospitals will have to look at based on even recalling some of the retired professionals if they have the ability, and they are looking at all of that. I don't want to speak for them, but I think those are some of the conversations that are already happening.
And the virtual assistant, are you launching that publicly today, or has it been already, you mentioned piloting it for about a week? And if it's so, how many people have signed on so far, do you know?
Yeah, it's not that it's going public today. We have been using it, and I just wanted people to be aware based on the fact that it is a different approach we're using, and they will get a text message, and we want them to be aware that this is another mechanism we're using. I'm not sure exactly how many people that are in the system right now. I'd have to look into that, but with the number of cases we have, let's hope there are a lot of people that are being reached this way, because it will help us.
Thank you.
Any additional questions from the Windsor Star?
Yes, Doctor, can you give us an update on the situation with our Agri-farms? I see there are 10 with outbreaks, but looking at the health unit's map on the website, you have 91 cases in Leamington total, 66 in Kingsville. So while we have a lot of outbreaks, how many cases are we seeing coming from those outbreaks?
So there are sometimes we don't know if they are from the farms until we get to the case and then issue and declare an outbreak. But as of today, to the best of my knowledge, we have 59 active cases in the Agri-farm workers, and I don't have a breakdown by municipality. There are agri-farms that are currently in outbreak, but as I mentioned, they are fairly contained outbreak at this time. And most of these individuals are currently being isolated, and our team is working with them directly, and there is also our local partners that are helping with the isolation and recovery, health assessment, and testing. So all of that work is ongoing, but the number is not as bad as it was in the summer, because at that time, majority of the cases were coming from the Agri-farm that were driving the number, but this time around, in the second wave, the numbers are coming from everywhere. We have cases from Agri-farm, we have many outbreaks, workplaces, community, they're from everywhere. So I can't say that the numbers that we are seeing right now, it's the Agri-farm cases are driving that number.
Okay, thank you.
Any additional questions from AM 800?
Just one, Dr. Ahmed, just looking at the website for the current outbreaks at long-term care and retirement homes. The last 5 that have been added to the outbreak list, it's all staff members. Any idea how these staff members are getting the virus?
Well, I think, Rob, the staff members are also members of our community. And if the community case rates are that high, the likelihood of them contracting it would be high as well. And I think that's why it is really important that when we are talking about lockdown, when we are talking about people needing to stay home, they should. And that's the most critical part. And I think at this time, even when Teresa is talking about the number of contacts and the various tools, I honestly, I feel like, why are we even having this many contacts from anyone? I think at this time around, people should be only notifying their close contacts as their family members. That's it. So it really is concerning when we have a number of close contacts that are not household contacts. And I think each one of us should be looking at it seriously and try to restrict your close contacts only within the people who live with you.
Thank you.
Any additional questions from CTV?
Yes, hi. I was wondering if you could speak on at all the province's new approach to vaccines. I understand it's no longer holding the second doses and is instead using those on more people. If you could just talk about that for a second.
Well, I think this is a new vaccine, and generally the vaccine science, the way it works is you give a first dose, it triggers a system, an immune response in your body, and the body starts to produce antibodies. And then with some vaccine, you need to give a booster dose to amplify that effect and to get the desired effectiveness or desired level of antibody that would be protective for you to get sick or to pass it on to other people. With this vaccine, the concern was the supply, and that whether we will get the supplies in time, and not knowing exactly that what would be the ideal time that we can give a vaccine and what would be the timeline if the vaccine is not given at that ideal time. So let's say for Pfizer, right now the schedule is you give dose 1 today, and then 21 days after you give another dose, and then second dose should act as a booster dose to trigger your immune system to generate the level of antibodies that would be protective for you. But let's say if you are unable to give that vaccine on day 21, and if you're giving it on day 28 or day 35 or day 42, how would that impact the immune response and whether the body will still be able to generate that kind of immune response or not? With other vaccines, that's okay. That has never been a concern. And obviously the full effectiveness almost always happen when the series is completed. So after two doses, the body will generate the immune response that we are looking for, but a delay generally doesn't impact that much. So with this vaccine, the saving the second dose was just based on the fact that there may be some issues or could have been some issues with the vaccine supply and distribution. And if that delay happens, it shouldn't impact anyone's ability or to develop the desired immune response and maybe potentially waste that vaccine. So I think it's a welcome move to see that now we have got better handle on the supply and distribution for all these vaccines. So we should be able to vaccinate more and more people, and as more supply come in, we'll continue to do the second dose of vaccination and maximize the number of vaccines that are available to us at this time to protect more and more people as quickly as possible.
Thank you.
Any additional questions from CBC?
Yes, I just have one last question. You spoke about the virtual tool, and I know that this will help reach people who you need to, but I'm wondering, in terms of contact tracing as a whole, I know you were struggling with that. Is there any improvement to that process at all, or is it still just as difficult as it was a couple of weeks ago?
So we have, I believe it's 1,700 active cases right now. So with all of those cases are the contacts. We do have a good system going with to try to reach the contacts. So we are enlisting the help of the provincial contact tracers, and they have been doing an awesome job. So we do feel that we are reaching people, but with 1,700 cases, our ability to do the in-depth interviews is very challenging because they take a long time. So we have adapted another modified version of that interview to try to increase the number of cases we reach in a day. So hopefully we're going to continue just working at it. It's we're doing the best we can under the circumstances, and we'll continue just to keep at it and try to get as many people interviewed and reach as many people as we can. But again, as Dr. Ahmed said, the most important thing people can do is, follow the public health measures. Stay home, don't go out, limit your contacts. All of this really, it's in everyone's hands to do their part, and then we'll see some real slowdown of the virus for sure.
And just one more follow to that, because I know that municipalities had offered, municipal workers to help with that, and I know that your response to that has been, this is a specialized process, and we require people with expertise to do it. I'm just wondering, at what point do you sort of shift to that war effort mode and just take the help that you can get and sort of make that work, or are we just not at that stage yet?
I think we are taking all the help that we can get, especially from the province and from our, hiring of people locally. We are going to continue to make sure that we have the right people doing the work of case and contact management. The offers from the municipalities, we have also taken the municipalities up on their offer and have given alternative ways to help relieve the pressure of our staff and of the work regarding COVID. And in particular, we are working with the City of Windsor regarding our call center. And I believe I've talked about it before. We have staff dedicated to answering the many calls that come in and from the public and from the residents of Windsor and Essex County, the cases, the contacts. So we are working with the city to kind of move some of the work of the call center to them, and I think that'll help tremendously. The number of calls we receive are huge, and then also we have. I'm trying to think of some of the other things that we put out there, but we are using our community partners and their offers to the best of our ability. So the fact that they may not be doing case management or contact management doesn't mean they're not helping in other ways. And you probably are aware that we work very closely with our hospital partners on all of these outbreaks and continue to do so. So when we say that we're not using people, I think that's not completely accurate. We're using every community partner and every offer to the best of their ability and our ability to make sure that we have the proper people for the work that needs to be done.
Got it. Thank you so much.
Thank you, everyone. Have a great day.